Today is a World Hepatitis Day. And everybody wants to know about the hepatitis, and we all know that hepatitis is the commonest infection in the world. 1/3 of the world population is infected with hepatitis B, and it is seen that 5 to 10% cases the virus does not disappear, and this leads to chronic career state of 5% in people. We all know that 25% of people who are hepatitis B carrier land up with problems like cirrhosis or hepatic cancers. So on this day, we have Dr. Ruby, who is a consultant in HIV as well as in communicable diseases, and the right person to give messages. We all know that, when the in medical college, the doctors and the nurses join, it is instructed that they should have this vaccination, hepatitis B vaccination, before they join this particular institute. I just wish that, it is still not 100%. I want Dr. Ruby, what is the clear message for the healthcare workers by Dr. Ruby on this particular important day?
Yes, Namaskar, ma'am. Thank you very much for this. Today is a World Hepatitis Day, and definitely this day is being observed to create the awareness about the disease. And basically because the disease is a burden to the world, and India is having the 40 million people with the hepatitis B infection, and it is a 11% burden of the whole world. And hepatitis C is approximately 12 to 18 million people are suffering from who are having the HCV infection, hepatitis C infection in India. So approximately 0.5 to 1.5% prevalence is having the hepatitis C. So we have the huge burden, and we know that this is the disease which can create the cirrhosis, which can lead up to the cancer, liver cancer, and it's a chronic disease, and it's a easily preventable disease, especially if we talk about the hepatitis B. Definitely this is the only hepatitis which has a very good vaccine available. Although we have the vaccine for the hepatitis A also, but for the country like India, we presume that hepatitis A antibodies are among more than 50% of the population is having hepatitis A antibodies, so it is not must for all. But the hepatitis B vaccine it should be a part of the national vaccination program and is must for all. Now it is a part of the child immunization program, but earlier it was not a part of the child immunization program in our country. So the population, our adult population, especially the population more than about 35 years old or 30 years old, they are not vaccinated with this particular vaccine. So, and it is a wise, very wise statement that all the students who are joining the medical college, whether it is the doctors or nurses or the paramedical staff or anybody who is working in a healthcare facility should be vaccinated for hepatitis B. It is something like if you have just learned the driving, you have just bought the bike, so you should have the helmet. So that is the must. So like that, hepatitis B vaccine is a protective measure, and it should be, everyone should be vaccinated for the hepatitis B vaccine before entering to the healthcare facility.
So I think, thank you very much. I think, Ruby, you had gave a very clear message to all healthcare workers that they should be vaccinated. Now, we also know that hepatitis B is very, very important in relation to pregnancy. And all the transfer of the mother to child transfer happens during this time. So what is your message for all pregnant ladies who are aspiring to become pregnant as far as this hepatitis B vaccination is concerned?
Yes, ma'am. Very valid this thing, basically, because if we want to eliminate the hepatitis B, if we want to protect our young generation for the hepatitis B, definitely we should prevent the mother to child transmission. As we know, hepatitis B is transmitted through the sexual contact, through infected syringes, through IV drug users, or the tattooing, or infected razors, blades, and a mother to child transmission. So every mother, before they just want the conception, so they should be vaccinated. They should make sure that they are vaccinated, and especially that will be great if they check their titers. Means the immunization. Nowadays you will see कि everybody is running for the COVID titers. मेरी antibody कितनी है, मेरी antibody कितनी है. So everybody is running for that. It's a very costly thing, but everybody is because of the fear. But for the hepatitis B, nobody is sensitized enough to check, to get this vaccine and to check the titer. But for the pregnant women, if we want to eliminate this disease, hepatitis B, which is the target of the WHO, which is the target of the India also for by 2030, they want to minimize this infection. So every pregnant woman should be vaccinated, should check the hepatitis B, and if they are not infected, they are not carrier, they should be vaccinated before they are planning for the conception.
That way, hepatitis B vaccination even during pregnancy also can be given. Now we come to a very important thing, which is called a needle prick injury. Now everybody is, whenever they have a needle prick during the surgery, whether the nurses or the doctors or otherwise, healthcare workers are worried about this needle prick injury, because if they do not know the status of HIV or hepatitis B and C, what you have to say? Everybody is scared about HIV, but they're not scared about the hepatitis B. What is your message?
Yes, ma'am. I'm being a HIV specialist. I'm seeing this every time when I'm just delivering the talk to the healthcare worker. The first question is, which disease you are afraid of? So everybody's answer is HIV, although its transmission rate is much lesser than the hepatitis B. HIV is also a lifelong disease. Hepatitis B is also a lifelong disease. HBV, hepatitis B, is 1 in 30 per 1,000 population. HIV is 1 in 300. HCV is 1 in 300, and HIV transmission is 0.03%, just only. So, but the fear is for the HIV is much more. And then this hepatitis B, one should understand, hepatitis B is the most transmissible among any other infection due to
1 in 3.
Yeah, due to needle-stick injury. So, and this is the disease which is having the very good preventable measure, pre-exposure prophylaxis in form of the vaccination. So we should motivate everyone to get the vaccine and not too afraid. They should be, basically, because it is also a chronic disease which does not have the cure. We can treat it, but we don't have the cure for the hepatitis B like HIV. And vaccination can save both way in the healthcare worker as well as the patient, because it is a two-way communication. Two-way infection can be. Patient can transmit to the healthcare worker, and healthcare worker also can transmit to the patient during the surgical procedure or during the any invasive procedure. So every healthcare worker should be vaccinated with this particular vaccine. Very few we can see cannot be immunized. I mean, they don't have the much of the titer. So this is a very few person. But if we know the titer, if we know the hepatitis B vaccination, so we can give them the duties into the non-invasive area. So that
now this has become universal, that the doctors community and the healthcare workers, their status is known from time to time, but now anybody who's coming for surgery is getting viral markers testing done, whether it for HIV, for hepatitis B, for hepatitis B, C, and syphilis. So I think this is to and fro infection has to be avoided. I wish to repeat what Dr. Ruby has said, that needle prick injury, hepatitis B has the highest chance of infection, 1 in 3. Hepatitis C has a chance of 1 in 30, and HIV has a chance of infection is 1 in 300. So this need to be remembered. Madam, you should tell me now, people are coming before surgery. Now, what precautions they should be taking during the surgery, so from the to and fro transmission does not take place. So we know that this person is a hepatitis B positive. What are your special instructions you want to tell them?
This is, ma'am, as for the any kind of the surgery, standard precautions. Standard precaution should be applied for any procedure, and especially in the surgical procedure. basically without being a person is HIV positive, hepatitis B positive, or hepatitis C positive or not. If we don't know the status, that should be the which is the all the protective equipments. So this implies
Yes,
with
so
the
as a
hand
surgeon, I
washing,
repeat,
gloves.
double gloves to be worn, regular change of gloves should be there if it's a long surgery, blunt tipped needle should be used, and stapling needle should be also blunt, and one should have a face cover as well as eyes cover should be definitely there, and we should try to see that anybody who has a needle prick injury, that time the surgeon or the nurse need to be changed. We should have an alternative people available, and then we should go ahead with the surgery. So these are the usual precautions we need to take. I'm going to ask last question from Dr. Ruby. How much, because we know hepatitis C is asymptomatic in majority of the cases. Unless we get it tested, we will really not know. What is your advice to the general public about this?
Yeah, it's basically because everyone, there should be the target thing. One should check their liver function test. If and the ultrasound or the fibros scan, if they have the fibrosis or anything with the fatty liver or this thing. If they are just having any kind of, basically because both are the slow progressing disease, hepatitis B as well as the hepatitis C. So not easily and not very early liver will damage, but it's a gradual process, it's a slow process, and gradually the liver will be cirrhotic and can lead to the death and can lead to the liver failure.
So the earliest detection can be the liver function can be deranged, or you can have infection.
Yes.
And if you have infection, things have to be watched that it does not lead to cardiac state. So I think with that particular thing, it was very happy awareness campaign as far as hepatitis B is concerned. And we are very, very thankful to Dr. Ruby, who is an HIV and infectious disease expert. And the clear messages have gone for the healthcare workers, for a pregnant lady who's aspiring to become a pregnant, needle stick injury, and what prophylaxis one has to use it. I just want to ask last minute about this. If there is a exposure to hepatitis B and C during surgery, what is your advice? Last minute.
For the hepatitis B, hepatitis C, we don't have any kind of the prophylaxis, only the monitoring till the window period is over, 0 week, 6 weeks, 3 months, and the 6 months. Then only we can just test it. And hepatitis C has the fully cure. So if the person is hepatitis C positive, we can just give the treatment. Right? For the hepatitis B, there are immunoglobulins. Definitely, we should check the titer, antibody titer of the hepatitis B. If the antibody titer is negligible, definitely the immunoglobulin has the answer. But it is a costly affair. It is a costly affair, and who will bear the cost? The hospital don't want to bear, a person has to bear. So this is a different story. But immunoglobulins are the answer for the post-exposure prophylaxis.
But it is said even if you are vaccinated and if you had an exposure to hepatitis B patient, it is asked that you should get yourself revaccinated within 24 hours and not later than 7. What is your impression on this?
No, ma'am. If the titer is good, there is no need of the revaccination. If the vaccination titer is not there, or if the person knows he is not vaccinated, then the vaccination is advisable. All the 3 doses, with all the 3 doses and the immunoglobulins.
Thank you very much. Thank you very much, Dr. Ruby. And thank you very much for people who are watching us during this particular awareness campaign of hepatitis B on a World Hepatitis Day. Thank you very much.